Good morning, dears. Today we are going to deal with the pancreatic tumors, especially the gastrinoma. As you know, the gastrinomas are the specialized cells which secretes high amount of gastrin. Due to high amount of secretion of gastrin, that may leads to the signs and symptoms of a case of peptic ulcer disorders. The G cells may or the gastrinomas may be seen in the head of the pancreas, or it can be in the specialized cells of the stomach or in the small intestine. So that is why if a person is having gastrinomas in different part of or any part of the GIT, or usually when it affects the head of the pancreas, automatically there will be increased production of hydrochloric acid. In such condition, the patient will complains usually with a sense of heartburn or retching or acid reflux or vomiting or nausea or pain. But on evaluating or endoscopical examination, you cannot see anything, especially in primary phase. That may be due to any of the gastrinomas here and there in the GIT. If a person is having such condition of uncontrolled production of gastric acid or hydrochloric acid due to the gastrinoma, such condition is termed as Solinger-Elsen syndrome. And these are usually present in the head of the pancreas, and sometimes it can be in the small intestine. And the issue of gastrinomas are usually these type of tumors are unfortunately malignant one. And along with the PUD symptom, our patient may having increased bowel movement, and the diarrhea may be the PC of your patient. And regarding the high secretion of, like too much secretion of insulin, when the beta cells proliferation or the mutation of the beta cells, that will result in tumor formation, insulinoma, and in such condition, uncontrolled production of or high amount of insulin that causes a severe or persistent condition of hypoglycemia. Fortunately, the insulinomas are very slow growing tumors and are very, very rarely spread from one part to another. But the issue is that the insulinomas can be present either in the head of the pancreas, or in the body of the pancreas, or in the tail of the pancreas. That means it can present anywhere in the pancreas. But fortunately, the insulinomas are benign in nature. They are not like that of gastrinoma. Gastrinomas are malignant, but insulinomas are usually benign in nature. The effect of insulinoma are hypoglycemia. Here, our patient's PC may be as blurred vision and feeling of or difficulty in visual issues, feeling of lightheadedness, then constant or persistent weakness or tired or a shakiness in our body, or mentally the patient is very nervous or irritable or confused one and very fretful, or fear of death as in case of our arsenic alb. On examination of your patient will be usually very sweaty, and the patient is having uncontrolled hungriness, wants to eat something always, and on auscultating you can see a very fast heart beating in patient. So a patient with a great prostration, with a headache or a vertigo or dizziness or a lightheadedness or a shakiness or nervousness, all these symptoms belongs to a condition of severe hypoglycemia, because the released glucose will be neutralized by the high amount of insulin. So on examination, your patient will be always in a state of hypoglycemia. That is the main issue. And let us study about the glucagonama. As you know, the tumors of the alpha cells, which secretes the high amount of glucagon, and that is why there will be persistent elevation of the glucose in our body or in our blood. Automatically our patient will have the symptoms of diabetes. Here our patient will have a headache, then frequent urination, dry skin and dry mouth, that means a sign of dehydration and feeling of hungry and always very thirsty and tired or weak. And due to this status, on examination, the blood clots can be seen in lungs, and the same may cause shortness of breath. Other symptom of our patient may be cough or pain in chest, like that of our brania. Blood clots in arms or legs cause pain or claudication or twitching and jerking of muscles, etc. And there may be swelling or edema, and on palpating the area may be very warm with a redness. And the GIT symptom of glucagonama may be as increased bowel movements, like that of diarrhea, and weight loss may be the one of the main PC of your patient than that of the above mentioned symptoms. And on examination there is soreness of tongue, and the soreness especially over the corners of the mouth may be the PC of your patient. All these symptoms are because of a condition known as hyperglycemia. In insulinoma there is persistent hypoglycemia, but in glucagonama there is persistent hyperglycemia. And usually the glucagonamas are usually present in the tail of the pancreas. So glucagonama in tail, insulinoma can be in body or tail, or even head. Then gastrinoma may be usually in the head of the pancreas. These are the main tumors which affects the pancreas, and at the same time, unfortunately, like that of gastrinoma, the glucagonama are usually malignant in nature. These are the main PC of or main tumors of especially the NET tumors, that means neuroendocrinal tumors of pancreas, and there are other types of tumors that can be studied in another class. Thank you for watching.